Immediately after, I still had numbing. A couple of hours later, swelling started to set in. I still felt okay.
Hey Annie, welcome back. I'm so excited to get to do your healthy aging plan today.
Lisa, I'm so happy to see you.
Yeah, so it's been a long time I've been taking care of you, and I know that we've done a really good job of making it look like time has just stopped and we've preserved your beautiful genetics. Something particular brought you in today, so go ahead and tell me what it is so I can help.
So you're right, GoodSkin has been great to me, but I'm definitely seeing changes in my brows.
Okay.
And we've treated it with Botox and it's just not lifting and holding the way that it used to. And so I saw that brow threads are kind of a big thing right now on Instagram, and I'm not sure if that's an option for me. I know that GoodSkin has its process that you use, and so if you can just let me know if this is something that works for me or doesn't work for me. And
Sure. Yeah. So I'll take you to the treatment room. The secret sauce, as you know, is palpating your face, figuring out what the actual problem is, diagnosing you, and then making the plan. So as you know, I say we can't figure out where we're going unless we know how to get there. So we're going to go ahead and make sure that the treatment will solve your problem.
Great.
Basically what I'm feeling for is to feel for like bony differences. What I can already feel is that this whole side of you kind of like sinks in, and then this whole side of you is a little bit more elevated. So my goal is going to be to give you a little bit more bone here. So I'm going to use a more structural type filler. I'm going to use Sculptra in your temples to give me that last layer of prevention. And then I'm going to use threads right here to give me a little bit of pull. So before we start treatment, let's go ahead and evaluate you for symmetry, because I know it's really this right brow that is bothering you the most. We're gonna do a little work on your left brow just for prevention, but at the same time I do have to treat your right brow more. So let me run you through your Vectra. Here's what's very interesting for me to show you is that we can see really quite clearly that your right brow has much less support. See where it kind of dips off, has much less support than the left one. Which would make sense that why when you see yourself from this angle, this edge of the brow is lower. So one of the issues, like I said, that people go and they get threads is they just walk into a clinic, they ask for threads, there's no actual diagnosis part, and then because there's no diagnosis part, the person leaves the clinic with the threads, they look good for 2 weeks because that's how threads can work. They give you this immediate lift, but then when the lift comes down and there's no support or structure, then the person thinks like the practitioner did a bad job, or they didn't like the clinic, or the results didn't last, and really all they needed to do was search for the problem. So for you, the problem is actually really this brow. So I'm gonna perform what's called a filler brow lift. We're gonna use a more structural type of filler to imitate bone. It's gonna go right here under your brow, you won't even see it. I'm then going to place some threads right here. Those threads are going to help anchor this brow more up. I'm going to place 2 threads here just to give you an additional little bit of lift. And then the last thing we're going to finish off with is prevention. So Sculptra is a collagen stimulator. Have you ever heard of Sculptra?
Yes.
Yeah, so it can last 2+ years. And I think it's really important that at every visit, we also prevent your aging so that we can help keep your face as it is. And so the Sculptra is going to go in this temple area. It's going to take some time to grow, but what's going to happen is as it starts to grow and thicken, it will help hold up this brow and it'll help keep your head from looking like it's shrinking in. What I'm doing first is I'm putting numbing for all the areas I'm going to treat so that she's a comfortable patient. You comfortable, Annie?
Yes.
Okay. Annie's very comfortable with treatments. If we have a client that's not comfortable, then we use laughing gas. People love laughing gas. They actually laugh. So I'm gonna start with filler brow lift is what we call it here. There's actually a fat pad under the brow and also a bony structure. So I'm gonna place the filler on the bone and then we're basically gonna get a little more bone for her. In terms of anatomy, the temporal artery does start to run more superficially, but I'm not treating anywhere near it, so technically I am in a safe zone. That said, I still am going to go through a number of checks before I inject the area to make sure that we're totally safe. Okay, so now we're gonna use our Sculptra portion. This is gonna prevent and also create a little more width to her head. Anyone watching this at home, we are getting into more dangerous zones. There's temple artery running here. It does come up superficial from a deep plane. That said, again, we need to reflux for a long time. And if you're choosing someone at home that's looking into treating your temple area anywhere in this zone, again, anatomy expert. One of the big fallacies is that people come in for under eye filler and they always say, oh my God, I heard I could go blind from under eye filler, when actually there's no vessels that feed the eye from down here. But there are vessels that feed the eye from up here. There are vessels that feed the eye actually from even your nasal labial fold and your nose, all here. So anytime you're getting injections through here, expert only, expert only. And I think someone who's taken cadaver courses creates a thoughtful, healthy aging plan for you, even if it's at another clinic, is someone that likely can do the job for you. Who is a good candidate for threads? Basically, again, we talked about understanding your underlying diagnosis, understanding if you need support or if you also just need pull on the tissue, and you also need to have thicker skin. So sometimes if a client isn't a good candidate right away for threads, what I will do is I'll spend 6 months thickening their skin with Sculptra, and then they can become a candidate for threads. Let's talk about anatomy. If you come into my office and you have a brow shape that is flat, and that's your natural genetic brow shape, I can't fight against that. I can't fight against that even with Botox. So the reason why this is going to work on Annie is because since she's been young, she actually always had a more cat-eye shaped brow. So if you're looking for that cat-eye shaped brow and that wasn't your natural anatomy, go see a plastic surgeon who may or may not do it for you or think it's a good call for you, but they're the ones who could be that decider for you, because what'll happen is you'll go to the med spa, you'll walk out, you'll look like that, and then in a week or two you'll look like that, because it's not your natural anatomy, and there is basically a tendon that holds things down, so you can't fight against that. So let's talk about what I've fixed from other clinics as well. I actually got a text message from someone who showed me a picture and their forehead was all wrinkled up. Do you see how right now when I pull on the thread, first of all, it's not pulling too much because she's numb, all right? Number one, you also see how you don't see the thread. You can't see any wrinkling. So that's an important point to note already. So when I saw this other person, you could see the full wrinkle of the thread, and that had to be removed. So again, take home message, get diagnosed properly by an expert. This is not for everyone. This is not for someone who doesn't have the natural anatomy, and not everyone should look at, this is for her to restore her cat eye shape that she always naturally had. If you're someone who doesn't have a cat eye shape and you think you're gonna go get it with threads, it will help just in the beginning, and then it will go away. So it won't really be a good investment for you in the long run. So at GoodSkin, we're all about the details and all about preserving symmetry. So for Annie, I just put 6 on her right side, that's her low brow. I'm gonna put 2 here for prevention and also to give her a tiny bit of lift, but we're gonna get her right brow up and correct. And again, we had to get that underlying support first, and then we're gonna treat her left brow just a little bit. So it is true, these threads will form a little bit of scar tissue. That's why, you know, you can do them again and again, but you reasonably can't do them again and again. There is a limit to how many threads you can have. And the other thing is that, like I said, you can't fight your natural anatomy with a thread. You can maybe alter it a little bit. So what we did today, just to recap, is we did filler brow lift, where we put filler structurally under here because this side we could feel that it was all coming down. We also then did 6 threads on this side. We did 2 threads on this side. This is her weaker side. She also told me that she sleeps on this side for many, many years, and she sleeps all so much curled in, so this has probably not helped why this side has started to have more pressure and cave in more. And then the last thing we did was we layered Sculptra. Sculptra is gonna thicken the tissue, help give me a little bit more lift over time. Every time we treat patients at GoodSkin, we think of how can we treat, but also how can we prevent? And the Sculptra is gonna be that little prevention piece. So if you have any questions about threads, Sculptra, filler brow lift, drop your questions below. We're happy to answer them. We definitely want you to receive expert treatment wherever you are.
I'm feeling great. I'm 2 weeks post my procedure. I did take a Tylenol before I went to bed. The next morning, the swelling was at its peak. So I definitely had 2 or 3 days where it didn't quite look the way that it looked when I walked out. I wasn't scared, but as with any procedure, you're always cautious. Going to Sculptra and the PDO Threads was not the first attempt we had done to kind of correct how my brows were falling. We had been doing Botox, and it just wasn't giving the lift that it used to have. But it was truly the combination of all of it. They know your anatomy. It's not a one-stop shop. I don't want to change who I am, and you do look natural, and people can't quite figure out why you're not aging. If it's a new person, their disbelief, and then you have to double down and actually have to tell them how old you are, which is never fun. But then the friends that do know you, they've said that my eyes look brighter. So I don't know if they know what it is that's different, but I have had that comment. So I'm super happy with the results. I feel that I look brighter and lighter, and that we were able to really address some of my concerns, and I love GoodSkin.